Instagram. My name is Dr. Julie Berg. I am a pediatrician in the emergency department at Children's National Hospital. It is my job to see children who come to the emergency department with a medical illness, injury, or psychiatric emergency. Today, I want to talk about psychiatric care for children in the emergency department. Now more than ever, families are turning to the emergency department for pediatric psychiatric care. The number of emergency department visits for psychiatric care has been increasing over the years, and now, with COVID, these visits represent a larger proportion of the total emergency department visits than ever before. The pandemic has made it more difficult for families to access mental health care in the community. What is a psychiatric emergency? There are three main categories of psychiatric emergencies. The first is when a child is at risk to hurting themselves. This could be saying out loud in person or online that they want to kill themselves, doing research or taking steps to prepare to kill themselves, writing a suicide note, writing a will, or starting to give away their belongings. The second type of psychiatric emergency would be when a child is at risk to hurt others. This could be saying in person or online that they plan to kill a specific person or a large group of people. They might act more violent towards others. They could start fires, destroy property, or harm animals, or even threaten another person with a weapon. The third category of psychiatric emergencies is when a child has a change in their behavior or thinking. This could be acting strangely and not making sense, losing touch with reality, seeing and hearing things that aren't there, or becoming paranoid. The role of the emergency department in psychiatric emergencies is to make sure that a child has a safe plan for ongoing psychiatric care. We have a team of doctors, nurses, social workers, specially trained child psychiatric specialists, and many other staff members ready to care for your child 24/7. So what happens when a child comes to the emergency department for a psychiatric emergency? There is a special set of procedures in place to help keep everyone safe when a child comes to the emergency department for a psychiatric emergency. For example, families and patients might be asked to put their belongings in a locker, and patients will be asked to change into a hospital gown. Sometimes a staff member may be assigned to sit with you and your child. An emergency department doctor will talk to you and your child to make sure that there are no medical problems that need to be addressed. The emergency department doctor will then decide if a safety evaluation is needed. One of our social workers will do the safety evaluation and then talk with a psychiatrist if needed. They will then decide the best next steps for your child's care with you. This can include being discharged home with resources and a safety plan, or being admitted to the hospital. There are many factors that go into this decision, and the social worker can answer any questions that you have. Psychiatric evaluations that are done in the emergency department are to assess for safety. The goal is to ultimately connect families with care in the community. Emergency department care is not a substitute for long-term, ongoing outpatient psychiatric care. We do not start psychiatric medications in the emergency department. This requires careful monitoring and ongoing care from either a psychiatrist or your pediatrician. We also do not do full psychiatric evaluations that are sometimes requested by schools. Thank you so much for listening and watching this episode of Bear Bites. If you have follow-up questions, feel free to leave them in the comments. If you are experiencing a crisis, please call 911 or bring your child to the emergency department at our main campus on Michigan Avenue or at our satellite location at United Medical Center.